Welcome, dear viewers. In today's episode of our health segment, we'll speak about dental caries or tooth decay. Most of the times you see people with teeth which are becoming chocolate or any other color, or some are facing tooth loss and everything. We'll delve into that and know what the causes, primary causes, health implications, and also go deep about dental caries. We are with Dr. Michael Kagoda. He's a dental surgeon here at Jubilee Dental Clinic. He will take us through and tell us more about dental caries. Welcome to our segment. We would like to know what are dental caries and what are the primary causes that may lead to tooth loss or dental caries in general.
Dental caries, in simple terms, or what they call tooth decay or cavities, is the breakdown of tooth structure caused by acids that dissolve the tooth structure produced by bacteria in your mouth. Yeah, in simple terms is what I would call it. So the breakdown in tooth structure can appear at home. You could see can appear from a white to brown to a black, change in color on the tooth surface, or to the point you actually see a hole on your tooth. Primarily, because it's acid that breaks down the tooth, usually there are four factors interacting at that point: your tooth surface, the bacteria in your mouth, interacting with their primary source of energy, which is sugar, and then those three having a lot of time together. Time is the other factor. So when the bacteria digest the sugar, refined sugar you give them, which is their primary source, have enough time with it, one of the byproducts they give off is acids. So those acids demineralize the tooth structure, the hard tissues of the tooth, that is your enamel, your dentine, and the cementum, then thereby forming the hole in your tooth.
What are some of the signs and symptoms associated with dental caries that one should be aware of, and when should one seek care, medical care?
The signs and symptoms, signs, you could see chalky white, your teeth turning chalky white, that's the earliest sign. Then your chalky white lesion could turn brown, or eventually it could turn black. Or you could see a hole in your tooth. After all those phases, you could see a hole in your tooth. That's what you can see at home. And then some symptoms, of course, include things like range from simple sensitivity to a cold drink or cold air. And then eventually the sensitivity could turn into pain that is provoked when you eat or drink, hot or cold. And then eventually it could turn into full-blown pain that is not provoked. The kind of pain that will wake you at 3 in the morning and you're looking for someone to help you. So if you persist and go through that, you could have what we call infection coming from a toothache. That's when you could see yourself swelling up. You could see yourself not being able to chew on your food, because when you chew, you're feeling pain. Number one, you should always see your dentist even when you don't have pain. It should be a habit that you, at least once a year, go see your dentist, have a checkup, and with some check x-rays, because some of these caries start in areas which can easily be seen with your eye. But when you take check x-rays, you find them especially in between the teeth. So it should be a habit. You see your dentist even when you don't have pain. But if you see any of the signs I mentioned above, or a change in color of your tooth, even without pain, then at that point you see your dentist immediately.
Can you discuss the impact of dental caries on overall health and how it can cause other related consequences when not treated early?
Some of the repercussions of dental caries include things like when someone has them, that it's difficult to eat. So you find that it's for, let's say, most times in children who cannot tell you I'm feeling pain or anything, when they have caries, you will see a child losing appetite to eat, and they're losing weight, which has impact on all the other systems of the body. That's one of them. Then you could go to things like tooth loss. So when people lose teeth, It could still impact in their digestion. It could impact in their self-esteem. Let's say you lost a tooth in the front, and then their social ability is reduced because they don't want to smile without a tooth, or they don't want to smile with black teeth that have caries in front. Then it could also impact on your economic status because you're spending a lot of money to get your teeth fixed and replaced and things like that.
Before we sum up our interview, are there any preventive measures that one can take to avoid tooth loss or avoid dental caries in general?
Yeah, the preventive measures are there. Like I told you, the other 4 factors: time, sugar, bacteria, and your tooth surface. So there are interventions centered around all those 4. So for things like the bacteria in your mouth, they're always there, but you could always reduce their levels through proper hygiene. You could get good brushing habits at least twice a day, more especially the nighttime. And also, in addition to the brushing, you do some flossing, where you pass a thread in between your teeth. At least the time you brush in the night, you also floss. Then you could also use antiseptic mouth rinses to control the bacteria in your mouth. Yeah, you could also use fluoride toothpaste. The fluoride tries to remineralize what the bacterial acids have demineralized. Yeah, so fluoride toothpaste and mouth rinses. Then there are things like if you have children and they've developed their first molar adult teeth, you could put things like sealants in the grooves of their teeth so the bacteria have nowhere to hide in the mouth. So it's also one of the preventive ways. And then on a public health level, they could add some fluorine in the tap water, piped water, so that people meet it even in their kitchen sinks, in their bathroom sinks as they brush, they're adding more fluoride in their teeth.